one resolution entitled Program Budget 2022 to 2023. Is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The second resolution, entitled Reducing the Burden of Non-Communicable Disease Through Strengthening Prevention and Control of Diabetes. Is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The third resolution, entitled Oral Health. Is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The first decision, entitled Follow-up of the Political Declaration of the Third High-Level Meeting of the General Assembly on the Prevention and Control of Non-Communicable Diseases. Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The second decision, entitled The Role of the Global Coordination Mechanism on the Prevention and Control of Non-Communicable Diseases in the WHO's work on multi-sector engagement for prevention and control of non-communicable disease. Is the Assembly ready to adopt the decision? I see no objection. The decision is adopted. The third decision, entitled Integrated People-Centered Eye Care, including preventable vision impairment and blindness. Is the Assembly ready to adopt the resolution? I see no objection. The decision is adopted, and the first report of Committee A is therefore approved. We will now consider the second report of the Committee A, which is contained in the document draft A74/62. The report contains one decision entitled Global Action on Patient Safety. Is the Assembly ready to adopt the decisions? I see no objection. The decision is therefore adopted, and the second report of the Committee A is therefore approved. Let us now consider the third report of the Committee A, which is contained in the document draft A74/64. The report contains one resolution entitled Strengthening Local Production of Medicine and Other Health Technologies to Improve Access. Is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted, and the third report of the Committee A is therefore approved. Let us now consider the fourth report of the Committee A, which is contained in the document draft A74/65. The report contains one resolution and three decisions. One resolution entitled Strengthening WHO's Preparedness for and the Response to Health Emergencies. Is the Assembly ready to adopt the resolution? I see no objection. The resolution is therefore adopted. The first decision, entitled Mental Health Preparedness for the Response to the COVID Pandemic. Is the Assembly ready to adopt the decision? I see no objection. The decision is adopted. The second decision, entitled Implementation of the International Health Regulation 2005. Is the Assembly ready to adopt the resolution? I see no objection. The decision is adopted. The third decision, entitled Special Session of the World Health Assembly to consider developing a WHO convention, agreement, or other international instruments on pandemic preparedness and response. Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted, and the fourth report of the Committee A is therefore approved.
Madam President, if you allow me, I see Chile is requesting the floor.
Okay.
With your permission,
Yes.
we give the floor to Chile.
Gracias.
Thank you very much indeed, Director General, Excellencies.
Statement on behalf of Bosnia and Herzegovina, Iceland, Libya, Moldova, Montenegro, Oman, Paraguay, Qatar, Sudan, Switzerland, Turkey, the EU and its member states, as well as the 26 proponents of the pandemic treaty, Chile, Costa Rica, Croatia, Fiji, France, Germany, Greece, Indonesia, Italy, Kenya, Korea, the Netherlands, Norway, Portugal, Romania, Rwanda, Senegal, Serbia, South Africa, Spain, Thailand, Trinidad, Tobago, Tunisia, Ukraine, and the United Kingdom. We are very pleased that we have reached consensus to pass a decision co-sponsored by more than 60 countries, and which creates a dedicated moment in November 2021 for a special session of the World Health Assembly to consider the benefits of a convention, agreement, or other international instrument on pandemic preparedness and response. In our view, a pandemic treaty under the roof of the WHO is the preferred way forward to strengthen the multilateral health architecture, including the IHR, and to head the call by so many experts to reset the system. Our discussion at the World Health Assembly, the welcome remarks by the world leaders, and the reports of the evaluation panels have confirmed the time to act is now, and many have spoken out in favor of a pandemic treaty. The open-ended working group established through the WHO Strengthening Resolution prioritized the assessment its finding to the special session. We need to capitalize on this momentum to act now for the next health crisis, or indeed the other crises are around the corner in today's complex and interconnected world. Indeed, the 26 proponents of the treaty decision and the partners are fully aware that this is not easy, and we are still working tirelessly to address the pandemic. Probably the most important lesson COVID-19 has taught us is the need for stronger and more agile collective defense against the health threats, as well as our building resilience to address future potential pandemics. A new pandemic treaty is central to this end. We all continue to work tirelessly and inclusively to turn this vision into reality. We are committing to seize this moment and welcome others, joining this collective action in our common endeavor for global cooperation, solidarity that extends beyond this crisis. Thank you.
We thank you, Chile. I see no other request for the floor for the moment. I pass the floor back to you, Madam President.
Thank you. Let us now consider the second report of the Committee B, which is contained in the document draft A74/59. The report contains 5 resolutions and 9 decisions. The first resolution, entitled "The Highest Attainable Standard of Health for a Person Living with Disability." Is the Assembly ready to adopt the resolution? I see no objection. The resolution is adopted. The second resolution, entitled "Recommitting to Accelerate Progress Towards Malaria Elimination." Is the Assembly ready to adopt the resolution? I see no objection. The resolution is adopted. The third resolution, entitled "Salaries of Staff in Upgraded Position and of the Director General." Is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The fourth resolution, entitled "Agreement between the World Health Organization and the International Organization of La Francophonie." Is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The fifth resolution, entitled "Participation of the Holy See in the World Health Organization." Is the Assembly ready to adopt the resolution? I see no objection. The resolution is adopted. The first decision, entitled "WHO Reforms and Governance." Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The second decision, entitled "The World Neglected Tropical Disease Days." Is the Assembly ready to adopt the decision? I see no objection. The decision is adopted. The third decision, entitled "Review of Entitlement of Members of the Executive Board." Is the Assembly ready to adopt the decision? I see no objection. The decision is adopted. The fourth decision, entitled "The Global Health Sector Strategies on respectively HIV, viral hepatitis, and sexually transmitted infection." Is the Assembly ready to adopt the decision? I see no objection. The decision is adopted. The fifth decision, entitled "Process for the Election of the Director General of the World Health Organization, Candidate Statement and Travel Support." Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The sixth decision, entitled "Process for the Election of Director General of the World Health Organization, Contingency Agreement." Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The seventh decision, entitled "The Appointment of the Representative to the WHO Staff Pension Committee." Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The eighth decision, entitled "The WHO Strategy on Health, Environment, and Climate Change, the Transformation Needed to Improve Lives and Well-Being Sustainably Through Healthy Environment." Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The ninth decision, entitled "The Role of the Health Sector in the Strategic Approach to International Chemicals Management Towards the 2020 Goal and Beyond." Is the Assembly ready to adopt the decision? I see no objection. The decision is adopted, and the second report of the Committee B is therefore approved. Let us now consider the third report of the Committee B, which is contained in the document draft A74/61. The report contains 3 resolutions and 4 decisions. The first resolution, entitled "Scale of Assessment of 2022 to 2023, is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The second resolution, entitled "Protecting, Safeguarding, and Investing in the Health and Care Workforce," is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The third resolution, entitled "Strengthening Nursing and Midwifery Investment in Education, Job, Leadership, and Service Delivery," is the Assembly ready to adopt this resolution? I see no objection. The resolution is adopted. The first decision, entitled "Report of the External Auditor," is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The second decision, entitled "WHO Programs and Financial Report for 2020 to 2021, including Audited Financial Statement of 2020, is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The third decision, entitled "Status of Collection of Assessed Contribution, including Member States in array in payment of their contribution to an extent that would justify invoking Article 7 of the Constitution, situation in respect of 2020. Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted. The fourth decision, entitled "Assessment of the Faroe Islands," is the Assembly ready to adopt this decision? I see no objection. The decision is adopted, and the third report of the Committee B is therefore approved. Let us now consider the fourth report of the Committee B, which is contained in the document draft A74/63. The report contains 2 resolutions. The first resolution, entitled "Social Determinants of Health," is the Assembly ready to adopt the resolution? I see no objection. The resolution is adopted. The second resolution, entitled "Ending Violence Against Children through Health System Strengthening and Multi-Sectoral Approaches," is the Assembly ready to adopt this resolution? I see no objection. the resolution is adopted and the fourth report of the Committee B is therefore approved.
Madam President, apologies. With your permission, I see that Argentina is requesting the floor. Would you allow me? Argentina, you have the floor, please.
Argentina is pleased to deliver this explanation of position on behalf of the following 32 member states: Argentina, Australia, Austria, Belgium, Bosnia and Herzegovina, Canada, Czechia, Denmark, the Dominican Republic, Estonia, Finland, France, Germany, Iceland, Ireland, Japan, Latvia, Luxembourg, Malta, Mexico, Monaco, Montenegro, the Netherlands, New Zealand, North Macedonia, Norway, Portugal, Romania, Slovenia, Spain, Sweden, the United Kingdom, the United States of America, and Vanuatu. We take the floor to provide an explanation of position on our support for the consensus adoption of this important resolution on our shared commitment to addressing violence against children. It is in the spirit that we reluctantly agreed to withdraw a critical paragraph from the final resolution in order to not break our long-standing practice of not voting on technical issues. We remain disappointed that similarly long-standing practice of this association was not employed by objecting member states. However, we want to take this opportunity to again reiterate our support for comprehensive sexuality education for children to realize their health, well-being, and dignity, to learn how to build healthy relationships, and to build communication, self-protection, and risk reduction skills as a fundamental part of efforts to prevent, recognize, and respond to violence against children. The term comprehensive sexuality education is based on already agreed consensus language used in other UN fora. And we believe we must continue our discussions to evolve our language in the World Health Assembly to this evidence-based standard for the benefit of all children everywhere. Information allows for understanding. Understanding is a pathway to tolerance, and tolerance leads to acceptance, inclusivity, and empowerment. We must be bold and we must act together to continue the discussions that we started during the World Health Assembly to move forward on these important issues as we build back better and meet our shared goal of ending violence against children. Thank you very much.
We thank you, Argentina. Madam President, I don't see other requests for the floor. I hand it back to you.
Thank you. Thank you, Argentina. This completes our consideration of item 8 of our agenda, report of the main committees. I would like to draw the Health Assembly's attention to the fact that under the provision of the Article 14 of the Constitution, the Health Assembly at each annual session shall select the country or region in which the next annual session shall be held, and the Executive Board will subsequently fix the date and the place. I take it that the Assembly decided that the 75th World Health Assembly will be held in Switzerland. Does the Assembly agree with this decision? In absence of any objection, it is so decided. We shall now consider the last item of our agenda, item 9, closure of the Assembly. I shall invite Dr. Adriana Amarilla of Paraguay, Chair of Committee A, to give us an overview of the work of Committee A. Dr. Amarilla, you have the floor.
Madam President, Excellencies, distinguished delegates, Dr. Tedros, ladies and gentlemen. It is with great pleasure that I present to you this report on the work of Committee A during 74th World Health Assembly. For the second time, the meeting was held virtually due to the continued COVID-19 pandemic. Despite the virtual nature of this health assembly, your continued commitment to strengthen global health and the World Health Organization was clearly heard. This World Health Assembly had the longest agenda in document history. We thank you again for your remarks, which allow all delegates the opportunity to deliver their statements during the regular working hours of the Assembly. Also, these hours might not have felt very regular, depending on which part of the planet you were connecting from. We miss chatting with you, but appreciate hearing your verbal statements and videos through the virtual platform. To address the exceptional circumstances, additional time was allocated for member states' statements on items related to public health emergencies and mental health preparedness for and response to the COVID-19 pandemic. Following the Executive Board's invitation to consider alternative modalities to allow more meaningful participation of non-state actors, we integrate a statement for non-state actors to be delivered in groups of constituencies in select agenda items of this year's Health Assembly. I believe this was a successful way to incorporate all perspectives into the debate. We have successfully completed the full agenda in a productive and efficient manner. The agenda items we cover are essential to the future work of the World Health Organization and to us all. Committee A approved 12 resolutions and decisions and also considered and noted numerous technical reports. We have substantially contributed to this pivotal moment in global health history. Just a few of the notable achievements over this last week include our approval of a 16% increase in the World Health Organization program budget, allowing World Health Organization to be better resourced for current and future global health issues. Reduction of the burden of non-communicable disease through strengthened prevention and control of diabetes 100 years after the discovery of insulin. Implementation, monitoring, and evaluation of the Immunization Agenda 2030 to integrate immunization service to reach all people with life-saving vaccines. Support for a stronger preparedness and response, including for mental health, and approving the special session of the World Health Assembly in November 2021 to begin a very important process towards agreeing on a global instrument to further strengthen pandemic preparedness and response. Madam President, Excellencies, distinguished delegates, Director General, and staff of the World Health Organization, it has been a privilege to serve as a chair Committee A. I wish to thank you for electing me to this role and for the opportunity to contribute to the critical work of this committee. I would also like to extend my thanks to Committee B for their support in taking on the deliberation on the 2030 Agenda for Sustainable Development, Health Workforce, Global Strategy for Women's, Children's, and Adolescents' Health, Social Determinants of Health, and Interpersonal Violence. Without your support, we might still be taking intervention from the floor now. I thank you, Madam President, for your leadership during this Health Assembly. I also commend my vice-chairs, Dr. Sweli Misk from South Africa and Dr. Ali Mohamed Mifat Al-Sinati from Libya, as well as my rapporteur, Professor Plamen Dimitron from Bulgaria. I express my appreciation for the representatives of the Executive Board for ensuring Committee A was well informed on relevant agenda items. Committee A's achievements would not have been possible without the dedication and professionalism of its Secretariat. I would like to thank the Secretariat of Committee A Carmen Dolea and Ian Roberts for their guidance, the Assistant Secretary for the grateful moderation, the support office who made the assembly flow smoothly, the wonderful interpreters and translators, the tireless IT team from their incredible work, and all the staff working behind the scenes. To the Director General, Dr. Tedros, the regional directors, and the whole World Health Organization leadership team, I extend my appreciation for all that has been accomplished during this World Health Assembly and through the COVID-19 pandemic, promoting health, responding to emergencies, and serving the most vulnerable on both sides of the river. I would also like to recognize the hardworking staff members of the World Health Organization for their constant commitment to improving the health of all people across the world, and to appreciate this year as the year of the World Health Organization's workforce. Madam President, Excellencies, distinguished delegates, Dr. Tedros, ladies and gentlemen, I wish you good health and look forward to seeing you at our next assembly in 6 months. Thank you very much.
Thank you. I would like to congratulate you very warmly for your excellent presentation and for outstanding way in which you have presided over the committee. I shall now invite Dr. Iframi Watanebeta of Fiji, Chair of Committee B, to give us an overview of the work of Committee B. Dr. Wagenabeta, you have the floor.
Madam President, distinguished delegates, Dr. Tedros, the Director General, ladies and gentlemen, it is with great pleasure that I present the report of Committee B to the plenary. I'm doing this on behalf of our vice chairs who have been working very hard, chairing our committee. They are Dr. Soren Rostrom from Denmark and Ms. Kazi Zubinesa Begum from Bangladesh. Our rapporteur, Lieutenant Colonel the Honorable Jeffrey Bostic from Barbados, and our Vice Chair ad interim, His Excellency Mr. Muhammad Mustafizur Rahman from Bangladesh. Madam President, I will limit my presentation to the main achievements and highlights of the work of Committee B, since we have all been kept fully informed about the progress of work through continuous interactions and through the daily journal. Building on the collective efforts and experience we have all grasped for the virtual conduct of the governing body proceedings, despite the special circumstances arising of the COVID-19 pandemic. The work of Committee B progressed very well from the start and was very efficient. This was largely due to the tremendous work of member states in the Executive Board and the Program, Budget and Administration Committee, their willingness to reach consensus which paved the way for the smooth conduct of Committee B, as well as the great support we have received from the Secretariat. We had consistent, insightful, and concise interventions of all delegates on the agenda items. The committee considered and approved 14 decisions and 10 resolutions, mostly on the financial, audit, staffing, and management matters under Pillar 4, which is more effective and efficient WHO providing better support to countries. The main highlights of the Committee B include the adoption of the draft decisions on WHO reforms related to governance, recommitting to accelerate towards malaria elimination, and the draft resolution of the process for election of the WHO Director General in relation to candidate statements and travel support, and also to contingency arrangements. The committee also adopted the draft decision to accept WHO results report for the program budget 2020 to 2021 and the audited financial statements for 2020 and the 31st December 2020. as well as the report of the external auditor. The committee adopted the draft decision on the health conditions in the occupied Palestinian territory, including East Jerusalem, and in the occupied Syrian Golan. The committee decided to refer to the 150th session of the Executive Board in January 2022 through the Program, Budget and Administration Committee, consideration of the status of collection of assessed contributions, including member states in arrears in the payment of their contributions to the extent that would justify invoking Article 7 of the Constitution with the delegation of power to make the decision related to voting privilege. We also addressed 5 items transferred from Committee A under Pillar 1 and 3. The committee adopted decisions on health workforce, strengthening nursing and midwifery, social determinants of health, and ending violence against children through health system strengthening and multi-sectoral approaches. I thank you, Madam President, for your most able leadership, guidance, and support in helping to make this a productive and successful assembly. I thank all delegates in the Committee B for their commitment, support, flexibility, and discipline while moving between the items at high speed at times. And to you, Director General, Dr. Tedros, I would like to extend our warm thanks for your personal engagement and the support of the Secretariat for our work in the Assembly, including finding an innovative way of facilitation of an intervention with your mobile phone. Also, to all our colleagues for the support and responses and advice provided to the member states in deliberations in the Committee B. Finally, I would like to thank our friends in the Committee B Secretariat, whose professionalism, diligent work, and consistent assistance during this virtual session have borne us safely and efficiently through the completion of our work. They have supported me and the other officers of Committee B in a truly formidable manner throughout these days and ensure the respect of all measures to prevent the spread of COVID-19 among those working on site. As we are coming to the end of the 74th World Health Assembly, it is time for us to jointly translate the decisions we made together here into actions back in our countries. Please allow me to wish you, Madam President, and all the other officers and delegates the very best for the rest of the proceedings. I would also like to thank the support I've received in Fiji, Dr. Ali of WHO and Dr. Tunrawu, and we look forward to resume your in-person World Health Assembly soon, hopefully next year. I thank you, Madam Chair.
I wish to thank you for your comprehensive report and your contribution to the work of the committee. Now that the main committee have completed their work, including consideration of the Executive Board's report, we are in the position to formally take note of these reports. I take it that the Assembly wishes to commend the Board on the work performed and express our appreciation to the dedication in which it was carried out, the task that is entrusted to it. Is the Assembly ready to take note of these reports? I see no objection. It is so decided. I would now like to hand over the floor to the Director General. Dr. Tedros, you have the floor.
Thank you so much, Madam President. Kadinche. The work of the Assembly would not be possible without the work and leadership of its officers. So I would like to thank the Chair of Committee A, Dr. Adriana Amaria of Paraguay. So thank you, muchas gracias to you and Paraguay, Madam Chair. And the Chair of Committee B, Dr. Ifremi Wangainabete. Vinaka to you, Your Excellency, Vinaka to you and Fiji. Thank you so much for your leadership. Thank you both for your leadership and service this week. As a token of appreciation, it's my great honor to present a gavel to the chair of Committee A and Committee B. So Dr. Adriana Amaria is with us, so please allow me to present the gavel, and then I will also provide another one to Minister Wangaina Bete.
Oh, that's wonderful.
Thank you. Thank you so much. And the second will be to Dr. Minister Wangaina Bete. Again, Vinaka, Your Excellency, and you have your pack also, which will be on its way to you. And thank you so much again for your leadership. Vinaka to you and Vinaka to Fiji. Finally, it's my great honor to present a gavel to the President of the 74th World Health Assembly, Her Excellency Daisho Dechen Wangmo. Honorable Minister Kadinche, to you and Bhutan, thank you so much indeed for your leadership this week. Thank you.
Make some noise. Thank you.
Thank you. Thank you. Before I pass it over to you, Madam President, I just want to just say a few words. We had colleagues, actually advocates for climate change, who visited us last Saturday, led by Professor Valérie du Acremont, and I received a letter plus from them and signed by hundreds of public health experts and health workers. And the message is very, very clear. It says in a summary, act now for life to recognize climate change as a health emergency. And not only that, they gave me in the letter, I will read the letter in a few minutes, how our health, human health, is very much similar to planet health. As you know, human health, 37 degrees centigrade is healthy. If you add 2, which is 39, you're sick. If you add further 2 and it's 41 degree will be mortal danger. And then if you add more and it's plus 5 degrees centigrade, 37 plus 5, that's too late. And for the planet, the same. So we need to take care of ourselves and our planet. And then the recommendations they have made is, I will not read the whole letter, but just focusing on the headlines. Number 1 is focus on preventive rather than curative care. Second, promote a more sober and equitable medicine. Third, develop environmental friendly, healthy structures. And fourth, focus on community-based care and support. 5, respect the natural environment. 6, organize information and education. And 7, involve the population and patients in strategic decisions. And in all that, leadership is key, and this is a message to you, which they asked me to pass to all member states. I am glad to have this opportunity to pass it over to you. But I would like to thank Professor Valéry D'Acremont and others who are advocating for human health and planet health. The two are interlinked, and we should act now for life, as they have said, and they should be treated as a matter of emergency, or we have to treat it with a sense of urgency. Thank you so much. With that, back to you, Chair. Thank you. Thank you again for your leadership.
Thank you, Dr. Tedros, for sharing that. Distinguished delegates, before we proceed further, I have the honor to welcome our high-level guest who will now address the Assembly. I have the pleasure to invite His Excellency Ilham Heydar Oghlu Aliyev, President of the Republic of Azerbaijan, to give his remarks.
Distinguished Director General, distinguished delegates, I would like to start by expressing my gratitude for the invitation to address the 74th session of the World Health Assembly, which takes place in a very challenging time for the global health agenda due to the current COVID-19 pandemic. Azerbaijan supports the leading role and efforts of the World Health Organization in the global health governance, including in coordinating the global response to the pandemic. From the very first days of the pandemic, Azerbaijan has taken practical measures to minimize negative impact of COVID-19 on the population and to keep the situation under control. Within a short period of time, 13 modular hospitals and 1 regular hospital were built. Total number of beds designated to treat COVID patients throughout the country is more than 10,000. At the same time, the socio-economic stimulus package worth almost $2 billion have been released in order to support COVID-affected people and business. As a result of comprehensive measures, our country has gradually eased the quarantine regime, and starting from today, 1st June, almost all current restrictions are being lifted. Within the next 10 days, the remaining restrictions will be removed, and thus Azerbaijan will return to the pre-COVID-19 situation. We have launched immunization campaign since mid-January this year, using 99.94% of Sinovac vaccine, and the rest AstraZeneca and Sputnik vaccines. 2 million vaccine doses have already been administered. This number constitutes 20% of our total population. All the citizens above 18 years old can get vaccinated voluntarily. COVID-19 passports are issued for those vaccinated. We welcome the designation of 2021 as a year of health and care workers. Azerbaijan has very fruitful cooperation with the World Health Organization. Last year, the World Health Organization hailed Azerbaijan as an exemplary country in fighting the pandemic. Azerbaijan has always propagated the importance of demonstrating a committed global solidarity to overcome the pandemic. In this capacity, as the chair of the non-aligned movement, Azerbaijan has initiated a number of global initiatives, in particular, the holding of the summit of the non-aligned movement in May 2020, and convening a special session of the United Nations General Assembly at the level of the heads of state and government in December 2020, which was supported by more than 150 states. Azerbaijan has made voluntary financial contribution to the World Health Organization in the amount of $10 million and provided humanitarian and financial assistance to more than 30 countries with regard to coronavirus. Azerbaijan publicly condemned actions of some countries which purchase several times more vaccines than their actual needs and deprive developing countries from protecting their populations. The persisting vaccine nationalism and deepening inequality in access to vaccines between developing and developed countries are disturbing. According to international reports, so far, more than 82% of the world vaccine doses have been purchased by wealthy countries, while only 0.3% have gone to low-income countries. To address this challenge, Azerbaijan, on behalf of the non-aligned movement, initiated a resolution on ensuring equitable, universal access for all countries to vaccines in the UN Human Rights Council, which was unanimously adopted this March. We strongly encouraged developed countries and international donor organizations to support developing, in particular, least developed countries to this end. Thank you.
Thank you, Excellency. I now have the honor to invite His Excellency, Mr. Scott Morrison, Prime Minister of the Commonwealth of Australia, for his remarks. Your Excellency, you have the floor.
Our world is at a pivotal moment. International health systems have been stretched to the very brink by COVID-19. The impact on our peoples and our societies has been truly profound. We must be united in our action to end this pandemic and to do everything we can to prevent the next one. In Australia, our COVID-19 response has been shaped by timely and decisive public health measures based on scientific and medical evidence. As the Director-General said at the beginning of the Assembly, health workers everywhere are doing incredible jobs under incredible circumstances. On behalf of Australia, we thank you. I also want to thank the World Health Organization and its staff for their ongoing work at the global, regional and national levels. At this very moment, vaccination against COVID-19 is uneven around the world, and so we all need to work together to quickly step up further our efforts to suppress global transmission. Australia is helping with the urgent need to scale up access, delivery and production of vaccines, particularly here in our part of the world. Globally, Australia has contributed some $80 million to the COVAX Advanced Market Commitment. We're providing help and vaccines to the Pacific and Southeast Asia, and includes some 523 million Australian dollars for our regional COVID-19 vaccine access and health security initiative. This initiative is providing doses, technical advice, training of health workers and cold chain support. We're also working with our Quad partners, the United States, Japan and India, to expand access to safe, affordable and effective vaccines, contributing some $100 million to provide last-mile vaccine delivery support in Southeast Asia. We agree that dose sharing must be part of what we do to close the COVID-19 vaccine gap. Australia has already provided more than 125,000 vaccine doses manufactured here to countries in our Pacific family, as well as our family in Timor-Leste, with many more to come. As we respond to the crisis today, it's also essential that we learn the lessons of this pandemic. I do welcome the landmark findings from the independent review into COVID-19. Australia strongly advocated for an independent review and bold reforms have been recommended. We must know how this began to ensure that we prevent another one in the future. I hear the call for greater engagement from the highest levels of leadership, and we must deliver. We need an agile and responsive global health security system, as Australia and I have advocated. It's essential that we strengthen global surveillance and provide the World Health Organization with the authority and the capacity to do this important job for all the peoples of the world. If we are to deliver on this ambitious reform agenda, then we must work together and put other issues aside. Many of the recommendations require WHO action, and I welcome the steps the WHO has already taken, including taking essential action on One Health. We must move quickly, and Australia is pleased to immediately provide the Secretariat with $3 million Australian to take forward this important reform agenda. As the independent panel co-chairs, the Right Honourable Helen Clark, Her Excellency Ellen Johnson Sirleaf have said, we cannot waste this moment. No one will be safe until we are all safe. There can be no delays. Australia will roll up our sleeves to do the hard work needed to make this pandemic the last we would hope, but to ensure that we do everything we can to protect against a future one. And we look forward to working with the global community on the shared challenge ahead. It's up to all of us. We are prepared to step forward and work together.
Thank you, Your Excellency. I shall now like to invite the President of Republic of Kazakhstan, His Excellency Kassym-Jomart Tokayev, for his remarks.
Dear Director General, dear ministers, participants, the World Health Assembly has met at a critical juncture. For 1.5 years, the whole world has been struggling with the spread of COVID-19. Each of us has felt the impact of the global pandemic. It became an unprecedented stress test for national healthcare systems and multilateral institutions. Throughout the global crisis, the World Health Organization has been actively engaging with member states. With its knowledge, passion, and expertise, the organization has led both developing and developed countries in the fight against the virus. It has brought together scientists and practitioners to produce scientific discoveries and urgently mobilized resources for those in need. Today, standing together at the pivotal moment of the pandemic, this Assembly provides a great chance to chart our future course based on solidarity and collective responsibility. As humanity, we need to learn the hard lessons of the past and present. We fully support proposals voiced by Director General Dr. Tedros Ghebreyesus aimed at reforming the WHO and making it a stronger, more effective, and financially independent international organization. An organization which is able to respond to all future challenges. Ladies and gentlemen, more than 3 decades after the Alma-Ata Declaration on Primary Health Care back in 1978, inequity in access to health care still persists. Our country is continuing to promote its essential principles within its successor, the 2018 Astana Declaration on Primary Health Care at bilateral and multilateral levels. The pandemic made it more than evident that a strong primary health care system is a crucial element of the effective response to any infectious disease. Together with the WHO, we intend to strengthen its regional office on primary health care in Almaty, so it can serve all countries of Central Asia and beyond. To conclude, I once again confirm Kazakhstan's unwavering commitment to the WHO. Thank you.
Thank you, Your Excellency. I am delighted and honored to now invite the Prime Minister of Kingdom of Bhutan, His Excellency Dr. Dasho Loteng Tsering, for his remarks.
Madam President, Dr. Tedros, ministers, and distinguished delegates, I have the honor to convey the prayers of His Majesty the King, Her Majesty the Queen, and people of Bhutan, the land of gross national happiness. As a medical professional, I'm always excited to be part of any event that is dedicated to health and well-being of humanity. And this year, the World Health Assembly becomes even more compelling as we gather to make decisions that are urgent, dynamic, and of huge impact to millions of lives. I've never imagined that I would have to live through such a pandemic in my life. I know this has been the same for all of you. We suffered together, but we will find solutions together. And I draw this confidence to say this from the hard work of Dr. Tedros and his team at WHO. The pandemic may have gloomed the world, but WHO's guidance to respond with scientific evidence, technical support, and moral inspiration has been outstanding. Moving forward, it is a proud moment for Bhutan to be chairing the 74th WHA. I have no doubt that Health Minister Dichin Wangmo will do justice to the responsibility, knowing her passion and experience. I'm also happy that she is there to share Bhutan's stories with her counterparts. Last year at this August gathering, I highlighted the need for global solidarity in our fight against COVID-19. The need is felt stronger today as situations worsen by the hour. Bhutan has not experienced the wave yet, but the pressure is building from all corners. We are doing everything possible, but how long can we withstand? Excellencies, the pandemic is a true test of time. Countries are pushed to realize its strengths and weaknesses. You all will agree that one quality that made the difference was the leadership. Bhutan has always been blessed with a leader who is learned, selfless, compassionate, and knows and believes in science. These outstanding qualities of our king secured the country from the pandemic so far. His Majesty takes it as his sacred duty to look after the well-being of all the people living in the country. Ever since the detection of COVID-19 in Bhutan, His Majesty has spent over 90% of his time outside the comforts of the palace. He has been touring all parts of the country to ensure safety and livelihood, coordinate responses, motivate frontline workers, and uplift the spirit of the people. And he leads by example, staying in mandatory quarantine and following protocols in all his travels. As pandemic pushed economies to shrink and thousands to lose their jobs in other parts of the world, His Majesty's wise and practical interventions have ensured livelihood of all Bhutanese within and those returning from abroad. Young people have been engaged in programs that motivate them to serve in the front lines, while others are given opportunities to acquire skills to equip them for future employment. It is also His Majesty's in-depth knowledge about the infection and herd immunity that led to Bhutan's successful first round of vaccination drive. We managed to inoculate 95% of the eligible population within 10 days. Of course, we are thankful to the Government of India for the vaccines. However, if these people do not get their second dose of vaccines on time, the advantage of mass vaccination will be rendered futile. Therefore, I would like to draw attention of countries that can support with vaccines for us and for all those who are suffering disproportionately, because the surest protection from getting severe COVID and its dreaded mortality is only through vaccination. As Dr. Tedros profoundly puts it, no one is safe until everyone is safe. As a practicing physician, I have immense appreciation for the scientists and generous investors for putting their brain and money behind the breakthrough. Messenger RNA technology, in addition to the vaccines, will open up its applications in medical science hereafter. Excellencies, while working to see the end of this pandemic soon, we must also be mindful of the consequences if routine health services are not given due attention and if preparation for future pandemics are inadequate. We do not know when SARS-CoV-2 will surface. it will be our fault if we are not prepared. Therefore, moving forward, WHO's role is increasingly becoming invaluable. With all the experience now, we are hopeful that the world will see even quicker and coherent progress in all the health-related domains hereafter. I would like to take an opportunity to say a special thank you to Dr. Tedros for the undeterred service to mankind at this critical time. Generations will remember you with much gratitude. On the similar note, besides the official partnership, the personal care and support we received from Dr. Poonam, from WHO Sero, and the country office in Thimphu made a lot of difference in this battle. Lastly, I would like to assure everyone that during Bhutan's presidentship year, we will do whatever it takes for a happier and healthier world. I look forward to meeting you all next year with the pandemic well behind us. For now, I end with prayers for the lives lost to the pandemic across the globe. Wishing you strength and more courage. Thank you and Tashidele.
Thank you, Your Excellency. It is my pleasure now to invite His Excellency Muhammad Ashraf Ghani, President of the Islamic Republic of Afghanistan, to give his remarks. Excellency, you have the floor.
Bismillahir Rahmanir Rahim. Dr. Tedros, Excellencies, ladies and gentlemen, the scale and scope of disruption caused by COVID-19 is posing the relevance of the concept of public commons and the tragedy of commons again. The good news is that there is an emerging consensus on the need to look at public health as a global public good in our interconnected world. The bad news is that the behavior of the international community is still marked by practices that have repeatedly led to the tragedy of commons, where pursuit of short-term interest by some member causes significant losses to the community. Confronting the challenge of the current and future pandemics will require discussion and agreement on the following issues: rules of the game for efficient, effective, timely, and transparent global response, institutional mandate and organizational resources for international and regional organizations to deliver public value during the conditions of pandemic, rules and organizational mechanisms for cooperation between international organizations, governments, and firms for production and distribution of vaccines in needed supplies, policies and agreements to ensure the functioning of regional and global supply chains and value chains, design and testing of social programs that would enable the excluded, poor, and vulnerable categories of populations, identification and mobilization of networks of talent that would be able to offer relevant advice on policy and implementation, and providing support for enhancement of systems of digitalization. A sufficient consensus on the role and functions of WHO will be among the first steps for moving towards the theory and practice of health as a public good. Like other countries, we Afghans have learned much during dealing with the 3 waves of COVID-19. Thanks to early warning by government of Abu Dhabi, we mobilized a whole-of-government response in February 2020. We framed our response in terms of acknowledgement, diffusion, adversity, relief, and recovery. To deal with the challenge, we reallocated resources, coordinated with international and regional partners, established mechanisms of cooperation with civil society, the market, and the media, designed and implemented programs for human protection, and focused in earnest on the problems of provision of health services by the government, private sector, and the third sector. While the adverse impact in our livelihoods, particularly the urban population, was significant, our loss of life, fortunately, in comparative terms, was minimal, partly explained by the fact that 70.6% of the population is below 30 years of age. Regional cooperation, particularly decisions by our Central Asian neighbors to keep the supply chains and value chains, and other neighbors to reopen their frontiers was critical in ensuring access to food and basic supplies. ADB, EU, the World Bank, and our other bilateral partners provided generous assistance. The performance of UN agencies revealed that their organizational culture and established business practices had not prepared them to utilize the resources efficiently and effectively, or to offer us timely policy advice. The Afghan diaspora, by contrast, performed a vital role in up-to-date analysis, timely advice, and selfless availability. Doctors and health professionals in the diaspora were available to us 24/7 from across the world. We dealt with the second wave with relative success also. The challenge during this wave was how to read the trends accurately and not impose unnecessary hardship on our fellow citizens. We used the opportunity to undertake a comprehensive review of our health sector, engaging closely with the critical stakeholders in reviewing the lessons on partnership. India showed us exceptional solidarity by offering 650,000 doses of vaccine, enabling us to attend to the essential sectors of our society and our armed forces. UN agencies, however, were unable to deliver the agreed-upon supplies of oxygen. We are now in the midst of the third wave of the pandemic. Our national capacity, thanks to political will and professional commitment and support from our national and regional partners, has been considerably enhanced. We are again focused on both modeling the unfolding of the wave and designing programs to enable us to overcome this wave successfully. Dealing with the challenge at the national level, however, has made us sharply aware of the need for an approach to COVID-19 and future pandemics through the perspective of global commons. Not only the international community is the knowledge and resources to avoid the tragedy of commons, the imperative of protecting and enhancing the quality of our lives, livelihoods, and well-being depend on cooperation at the global level. Hence the importance of today's meeting. I wish you success in your deliberations.
Thank you, Your Excellency. I have the honor to invite the Prime Minister of Malaysia, His Excellency Muhyiddin Yassin, for his remarks.
Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Tedros Ghebreyesus, Director General of the World Health Organization, Her Excellency Dasho Wang Mo, President of the 74th World Health Assembly, distinguished delegates and participants, let me begin by thanking Dr. Ghebreyesus for giving me the honor and opportunity to address the closing session of the 74th World Health Assembly. The theme of the Assembly for this year is apt. Global resilience requires us to not only address the current crisis, but also protect our people from future pandemics. Malaysia applauds the World Health Organization for designating 2021 as the International Year of Health and Care Workers. We are humbled by the abundant sacrifices. We are in awe of their courage and fortitude in the fight against COVID-19. We owe the healthcare frontliners of the world a debt of gratitude, including in Malaysia. We have saved countless lives and the futures of generations. From the beginning of the pandemic, Malaysia took a whole of government and a whole of society approach based on scientific data and public health recommendations in addressing the unprecedented health crisis. We executed a clear strategy which focused on three thrusts: expanding our healthcare delivery system to prevent spread and to tend to the infected,
providing strategic fiscal injections to safeguard the economy, and protecting the people's livelihoods. In improving our healthcare delivery system, we empowered the Ministry of Health to be at the forefront of the pandemic response. The Malaysian government swiftly increased budget allocations, and to date we have spent 69.3 billion ringgit, roughly 16.7 billion US dollars, on boosting healthcare capacity, which constitute 4.89% of GDP. It is the largest and most acute rise in spending for public healthcare in Malaysian history. And this also includes investments in the wider use of technology, from contact tracings and digital vaccination certificates on handheld mobile devices, blockchain for vaccination management system, to the use of artificial intelligence and machine learning to identify hotspots for outbreak of disease. The COVID-19 pandemic continued to challenge us in so many ways. Aerosol transmission, multiple variants, and pandemic fatigue have made containment of the infection difficult, especially for countries like Malaysia, where our economy is driven by small and medium enterprises in our multi-racial demography, where culture is diverse. The only hope for our world to end this pandemic is to ensure as many people as possible are vaccinated as rapidly as possible. Now, even as I speak, Malaysia, like many other countries globally, is facing another surge in cases. Our healthcare frontliners are once again under tremendous pressure, and the resilience of our healthcare systems are being tested day by day, and thankfully holding up thus far. Malaysia reiterates its call for universal access to COVID-19 vaccines. These vaccines must be affordable and accessible to all. We joined the COVAX facility to facilitate the equitable distribution of COVID-19 vaccines globally, and commend the WHO for spearheading this effort. I'm delighted to note that Malaysia has started receiving the delivery of the vaccines procured through COVAX. But unlike countries from the West, we have to wait for our supplies initially trickling in, which brings me to this. We can only be safe when everyone is safe. Vaccine equity is still a major issue, and we cannot win this war against the virus unless everyone has equal and rapid access to vaccines. Malaysia's commitment to the universal health care extends to its non-citizen. The government of Malaysia continues to provide free health screening and treatment for COVID-19 infections, and will offer free vaccination to everyone in our country, whatever their citizenship or immigration status. Since last February, under the Malaysia's National COVID-19 Immunization Program, we have successfully inoculated just over 5% only of our population. And this is nowhere as fast as we had hoped, but our pace is very much dependent on the supply and delivery of vaccines from the manufacturers. Malaysia requires 53 million doses of vaccine to meet the needs of 70% of its population. And to date, we have only received just under 3.2 million doses or 6% of our required doses. And with the expected arrivals of more vaccines the next couple of months, we hope to increase our daily vaccination rate from 100,000 to between 200 and 300,000 per day, so Malaysia can achieve herd immunity against COVID-19 before the end of this year. Malaysia is scaling up vaccinations through public and private health partnerships and also implementing many good practices observed from other countries, from the citizen engagement and outreach of countries like Bhutan, drive-through vaccination as in Arizona, USA, to the use of mega vaccination sites from now underutilized convention centers and stadiums, and also done by our neighbors in Thailand and in many other countries in the region. The rollout of the vaccination offers hope for us to win the war on COVID-19. It has already evidently done so much in wealthy countries which have an abundant access to vaccine, but we need all countries to have the same opportunity. Distinguished participants, Malaysia is very grateful for the confidence placed in us by the member states of the Western Pacific region as the new incoming member of WHO's Executive Board. We are committed to working closely with the WHO and other countries in strategic partnerships as guided by the General Program of Work 13 to achieve universal health coverage, address health emergencies, and promote healthier population in line with the 2030 agenda of the Sustainable Development Goal. I would be remiss if I did not take this opportunity to address some less mentioned concerns. Firstly, the impact of this pandemic on mental health and social well-being. There is nothing natural about self-isolation and the toll it takes on our global citizens, young and old, the disruptions to education, work, and social norms. It will require us to endure a healing process that will take time. Secondly, the findings from the Independent Panel for Pandemic Preparedness and Response has given us clear analysis and recommendation so that together we can make this the last pandemic. While we must commit to taking actions and ensuring multilateral cooperations and commitment to achieve this goal, let us also not forget that the rise in zoonosis and pandemic risk has a direct correlation with transgressions of our planetary boundaries, and our future development must consider the protection and the health of our planet. While the end to the COVID-19 pandemic may still be some time away, we in Malaysia hope that the global situation will continue to improve. Imagine the benefit to all of humanity if only more vaccines were immediately made available to people in need across the globe. We welcome the call for People's Vaccine and Trade-Related Intellectual Property Rights, or TRIPS, waiver to allow vaccine manufacturing in the developing world. This is a fight we cannot afford to lose. You can certainly count on Malaysia being a strong partner to WHO to create a healthier, happier, and more equitable world for all. But thank you.
Thank you, Excellency. Finally, it is my pleasure to give the floor to President of Argentina, His Excellency, Mr. Alberto Fernandez, for his remarks.
Thank you very much. I'd like to begin by expressing my thanks for the invitation given to me to participate in this World Health Assembly. I'm very grateful for the invitation because in Argentina we are going through very, very difficult times, as indeed the rest of the world has been and still is. We're not the only country going through the worst time of the pandemic. Inter alia, the pandemic has exposed the rampant inequalities around the world, the concentration of income in a few hands and the suffering of poverty by many millions. However, at the same time as it's done that, it's shown up the urgent need for solidarity, a concept which even the most extreme forms of capitalism have not made us forget. Pope Francis said quite rightly, nobody can be saved alone. That's true. And acting collectively will help us to tackle the problems of the present and the future better. Solidarity has not, unfortunately, been the rule of the game in the past, but now it has to be for us to be able to face the unknown, because the pandemic basically was the unknown to a great extent. It still is. It's been a virus that's attacked the health of individuals, but the health of communities as well, and it's also had a massive impact on economies, the fallout from which is only just becoming visible. It's highlighted two further aspects, one very positive, one slightly more negative. What was very positive is that it set an enormous challenge for the scientific community to find a vaccine that would help us to bring an end to the scourge of the pandemic. And the vaccines came. They found the vaccines. The UK, the United States of America, Germany, the Russian Federation, China, India, people have cooperated and contributed from all those countries and from more, from Cuba and others as well. That's the positive aspect. The less positive aspect is the production of the vaccines. That has not occurred all around the world. What we've got is, say, a dozen countries who can produce vaccines, have managed not only to produce but to purchase about 90% of them. Everyone else has had to go searching for the vaccine in order to try and get sufficient quantity of it to vaccinate our people. Solidarity there has been fairly non-existent. At the first meeting of the G20 since the outbreak of the pandemic, I urged that several things be done. The first thing I said was that in a time of pandemic, we should not be seeing blockades put on countries anywhere. In ethical terms, they are unacceptable, and there have been countries on my continent, in my part of the world, who have been having to tackle the pandemic while suffering under an economic blockade. I'm talking about Cuba and Venezuela, and frankly, that is obscene. We're not talking about the strength of a government here. What we're talking about is the protection of individual lives, the lives of men and women, and that isn't something that we should be bringing into debate. The second thing I urged was that when the vaccines appeared, as they now have done, they should be treated as a global social good, that patent restrictions should be lifted so that everybody who could use and have the opportunity to produce vaccines for our people. The pandemic's been going on for over a year now. The vaccination process is underway. We'd all like to see it happening quicker, I think, so that we can finally declare real victory over COVID-19. But we've got a long way to go before we can do that. It would be a good thing if so much suffering and so much death made it possible for us to look at the international community that we are and ask ourselves whether we want to continue in such a world with so much pain, so much suffering that leads nowhere, and so many inequalities inequalities that cause that suffering and death. As the Pope said, you can't save yourself individually. Thank you.
Thank you, Your Excellency. We sincerely extend our appreciation to all our high-level guests for making the time to join us. I shall now invite Director General for his closing remarks. Dr. Tedros, you have the floor.
Your Excellency, Madam President, Excellencies, colleagues, and friends. First of all, I would like to thank Your Excellency Daisho Dechen Wangmo for your leadership this week and as President of the 74th World Health Assembly. I would also like to thank the chair of the committee, Dr. Adriana Amaria, of Paraguay, and the chair of Committee B, Dr. Ifremi Wangiabete of Fiji. Thank you both for your leadership this week. I would also like to thank all member states for the constructive and collaborative way that you have worked this week to address a full agenda of pressing health challenges. I know that the past week is the culmination of months of work for many colleagues, member states and the Secretariat alike, who have engaged in long hours of consultations, negotiations, and preparations that have resulted in a smooth and successful assembly. You have adopted more than 30 resolutions and decisions on diabetes, disabilities, ending violence against children, eye care, HIV/AIDS, hepatitis, and sexually transmitted infections, local production of medicines, malaria, neglected tropical diseases, non-communicable diseases, nursing and midwifery, oral health, social determinants of health, and strategic directions for the health and care workforce. And this morning, you approved a historic resolution on strengthening WHO preparedness and response for emergencies. I would like to thank all member states for the support they expressed for WHO and for making it stronger. The reports of the IPPR, the IHR Review Committee, and the IOSCE are unanimous in their view that the world needs a stronger WHO at the center of the global health architecture. There are many recommendations in each of the reports about how to achieve that, and many of these recommendations require further discussion with member states. As the reports all say, and many member states have emphasized, a paradigm shift in the quantity and quality of funding of the Secretariat is a key issue. Throughout this assembly, many member states have spoken about their reliance on WHO experts at all levels for technical guidance. Our staff really appreciate this. But the reality of our funding model is that many of these expert colleagues are on short-term contracts, and even if they are not, their programs have to be planned in a debilitating cycle of financial ebb and flow. Even in the midst of this pandemic, we face a serious challenge to maintain WHO's response to COVID-19 at its current level. Last week, you heard about WHO's coordination in country, the technical support and guidance we provide, the capacity building and training of health workers, the scaling up of sequencing, the critical supplies, the surge deployments, and much more. It all has to be funded. We cannot pay people with praise, and WHO cannot grow stronger without sustainable financing. This is not a new issue. More sustainable financing has been one of my priorities as part of the WHO transformation. However, there have been two big differences at this assembly. First, the message that a strong WHO needs to be properly financed has been amplified by all the expert reviews that reported to this assembly. But the second thing that is different is that we have a way forward. I thank the Working Group on Sustainable Finance for its work so far and for its encouraging interim report to this assembly. And thank you especially to Germany and Björn Kummel for their leadership of this initiative. We look forward to its final report to the Executive Board in January. I also thank Member States for approving the planned program budget for 2022 and 2023. For the long-term strengthening of WHO, I urge Member States to seize this pivotal moment and chart a course to a sustainable financial model through the recommendations of the Working Group. In the medium term, I ask that you fully fund the next program budget. And in the short term, I ask you to fill the significant shortfall in the WHO Strategic Preparedness and Response Plan with the flexible funding we need to deliver on the promise of the ACT Accelerator and save lives. The theme of this assembly is, as you know, ending this pandemic, preventing the next one. The reality is we still have a lot of work to do to end this pandemic. We're very encouraged that cases and deaths are continuing to decline globally. But it would be a monumental error for any country to think the danger has passed. The tailored and consistent use of public health measures in combination with equitable vaccination remains the way out. I urge all Member States to commit to supporting the targets I set out on Monday to achieve vaccination of at least 10% of the population of all countries by the end of September and at least 30% by the end of the year. One day, hopefully soon, the pandemic will be behind us. But the psychological scars will remain for those who have lost loved ones, health workers who have been stretched beyond breaking point, and the millions of people of all ages confronted with months of loneliness and isolation. And we will still face the same vulnerabilities that allowed a small outbreak to become a global pandemic. The questions the pandemic is asking us cannot simply be answered with new institutions, mechanisms, facilities, or processes. The challenges we face are profound, and so must be the solutions we design. Strengthening WHO certainly means strengthening the Secretariat, but it also means strengthening the bond between member states, which is very crucial. That's why the one recommendation that I believe will do most to strengthen both WHO and global health security is the recommendation of a treaty on pandemic preparedness and response. That could also improve, as I said earlier, the relationship between member states and fosters cooperation. This is an idea whose time has come. We need a generational commitment that outlives budgetary cycles, election cycles, and media cycles. That creates an overarching framework for connecting the political, financial, and technical mechanisms needed for strengthening global health security. At present, pathogens have greater power than WHO. They are emerging more frequently in a planet out of balance. They exploit our interconnectedness and expose our inequities and divisions. The safety of the world's people cannot rely solely on the goodwill of governments. Every government is responsible for and accountable to its own people. But member states can only truly keep their own people safe if they're accountable to each other at the global level. The defining characteristic of the pandemic is the lack of sharing of data, information, pathogens, technologies, and resources. These are the challenges we have been facing since the pandemic started, and even before. A treaty would foster improved sharing, trust, and accountability, and provide the solid foundation on which to build other mechanisms for global health security. For peer review of national capacities, for research and innovation, for early warning, for stockpiling and production of pandemic supplies, for equitable access to vaccines, tests and treatments, for an emergency workforce, and much more. A treaty is a promise to future generations to sustain political and financial commitment. Crucially, an international agreement of any kind must be designed and owned by all member states. All. It must be truly representative and inclusive. It must be thorough and carefully considered. But it must also be urgent. We don't have time. There is no reason we can't do both. We must seize the moment. In the coming months and years, other crises will demand our attention and distract us from the urgency of taking action now. If we make that mistake, we risk perpetuating the same cycle of panic and neglect that has held us to the point. We appreciate the strong support expressed by dozens of member states for the idea of a global agreement on pandemic preparedness under Article 19 of the WHO Constitution. More than 60 countries have sponsored it, as the ambassador of Chile said earlier. We look forward to discussing this idea further with member states at a special session of the World Health Assembly in November. You, our member states, have demonstrated this week that with commitment, hard work, and a willingness to compromise, to cooperate, it's possible to find common ground, even on issues where there are deep differences of opinion between you. That same commitment and willingness is needed now. Pandemics are a threat to all of us, so we must work together to build a healthier, safer, fairer future for all of us. The pandemic has taught us many lessons. Among the most important is that when health is at risk, everything is at risk. But when health is protected and promoted, individuals, families, communities, nations, and economies thrive. That we all know. So we call on all member states to enshrine the right to health in their constitutions, as indeed many have already done. But the right to health cannot, must not become an empty slogan. It must become the experience of every person in every nation. Madam President, you said in your opening address to the Assembly that leadership is hard to define and harder to find. This is a moment for exceptional leadership, for doing the unusual and the unprecedented. We must approach the future with open eyes and open arms. As the Bhutanese proverb goes, I quote, "If you want to action great ideas, you need to apply the strength of a Himalayan mountain," end of quote. And earlier also, the Prime Minister of Bhutan said, which I think goes around same line, we suffer together, we find solutions together. Kadinchi, shukran jazilan, shishe, merci beaucoup, muchas gracias, spasiba balshoi. Thank you very much. Thank you. Thank you so much indeed. Thank you.
Thank you, Dr. Tedros, for that inspirational speech. Director General, WHO Regional Directors, Your Excellencies, Honorable Ministers, Head of the Delegations, colleagues, ladies and gentlemen. I would like to take this opportunity to make a very brief remark as this session of the Health Assembly draws to a close. It is a profound honor for my country, Bhutan, and for me personally to serve as the President of the 74th World Health Assembly. I've been humbled by all the messages of congratulations and support that you have offered when we opened the Assembly here in this room, and at the same time opened in all your rooms around the world. So please allow me to offer my gratitude in return to all of you in joining the meeting today by the Zoom platform for successfully co-staging this event. For many of you, it has been not easy. You have worked long and often inconvenient hours in small, often inconvenient space, isolated from each other, overcoming local challenges that are no doubt as varied as each of your personal environment and each of your individuals. You have my solidarity, respect, and deep thanks for making this arrangement work. It was critical that we met together over the last 8 days to discuss the pandemic and more profound threat to have faced humanity in the last century. Critical that we find a way to agree some common solution to the pandemic, and critical at the same time to address a greater number of technical, budgetary, administrative, legal issues relevant to international public health than any previous assembly have ever included in its program. As a result, we have achieved a lot. Previous speakers today have already identified a number of highlights, so I will not offer a competing list, but rather everything we have agreed to do together is important. For my part, I commit to working resolutely to help Bhutan play its part. As the President of the Assembly, I am very proud of the outcome of our discussion. I am proud of all of you for your many contributions to drafting resolutions and decisions, for negotiation undertaken late into the night in the days, weeks prior to the Assembly, and for your flexibility, patience, dedications, passion, as we talked in through 3 virtual spaces over the course of the last 8 days. These instruments, agreed by you all on behalf of the government and the people you serve, will make the world a better, happier, and a healthier place, and I thank you sincerely. If I am permitted, a small note of concern in relationship to the Assembly. It would be for the occasional dotting of the member states' intervention with comments of political nature. As a president, I have seen and felt the effect that these comments have on our member states and on our debates. It used to be that we, as national global health leaders, given the honor and the responsibility of charting the future course of international public health, would leave at the doorway as we came into the consideration of the partisan or political nature, and in this forum offer each other only science and humanity and seek only collaboration and wisdom. My friends, it seems to me that this wonderful convention have been put under greater and greater strain over the course of the last few assemblies. And now it is in danger of breaking. I urge each of us to reverse these trends. It will require a conscious effort from each of our delegation to regain that lost ground, since it will require, as a first step, that we each draw a line under any comment that we may have felt were unfairly directed towards us. But doing so, it's the only way. We have to let go of the anger. This assembly does critical work. We can only give that work our full attention if we focus on the central issue of public health. Because, Your Excellency, distinguished delegates, ladies and gentlemen, there are mountains in front of us that remain to be climbed. If we are to overcome COVID-19, let alone all other issues that we have raised. Those mountains are formidable. Diagnostics, therapeutics, vaccine must be manufactured, distributed, and deployed. Healthcare workers must be trained, resourced, protected, and supported. Billions of large and small conversations are needed with patients, with their families, citizens, staff, and private sector. And all of these need to happen as quickly as possible, while we continue to generate evidence and learn from it, and while maintaining empathy, compassion, and respect for each other. For these, we will continue to need each other. Never has the world felt as big, yet so connected. In that vein, I am personally grateful to so many individuals and groups for their help during the assembly. To my 5 vice presidents, Professor Benjamin, Mr. Ekman, Dr. Hanan, Mr. Tanel, and Dr. Amarilla, and to the chair of Committee A and Committee B, Adriana Amarilla, Dr. Ifani, as well as the vice chair and the rapporteur. Thank you all for your support in guiding the assembly. I would exceptionally like to recognize the 2 committees chair and the vice chair. Thank you for your wonderful interpretation, who do difficult job exceptionally well, making it possible for all of us to communicate seamlessly across 6 languages. I thank all the interpreters. Thank you to the WHO staff who have worked tirelessly here in Geneva to prepare for and support this assembly. Those staff includes the team in the governing bodies, legal, conference system, and the IT section. The job they do is not easy. I also thank the WHO regional and country office staff for the extraordinary effort they have made to assess our work. To my friends and colleagues in the health ministries, thank you again for your hard work and perseverance. I wish you courage and good fortune in the days ahead. Last but not the least, to Dr. Tedros, thank you for your unwavering leadership, your energy, and your positivity at the time of global crisis. I look forward with hope to the time when we are all possible for us to meet in person again, perhaps at the special session of the Assembly later in 2021. In the meantime, please let me convey the good wishes of His Majesty the King, the royal government, and the people of Bhutan, and offer my prayers for you and those around you. Thank you again for the collaboration and the platform. Tashidele. I now formally declare the 74th World Health Assembly closed.
Universal health is you and you and you.